Hey there, guys. Welcome to discussion of Chapter 14, Managing and Governing Healthcare Organizations. First, let's begin with the three types of healthcare organization, or HCOs. First, you have nonprofit. Nonprofit organizations are owned by the nonprofit board and are regulated by the state where they were established. For example, the nonprofit foundation, the Kennedy Austin Foundation. It's located right in Pomona and has been adopted by our College of Allied Health Professions. And our previous chair, Dr. Meyer, is on the board of the foundation. And you guys will probably become more familiar with them as your time progresses within the program. Next, we have the public organizations. Public healthcare organizations, like a state-owned medical school, have boards appointed by public officials. And then lastly, for-profit healthcare organization boards consist of investors, which are usually stakeholders. So I hear you asking me, what do boards do? What do board members do? Well, usually they encourage, advise, and evaluate. Occasionally, they may have to replace the chief executive officer. They discuss, review, and approve strategic direction. They monitor the performance of the organization. They also ensure that the organization operates responsibly and effectively. It is also the responsibility of the board to act on specific policy recommendation. Board members may need to be a buffer for the president or the chief executive officer, like they may need to take the heat sometimes for them. They make sure that the necessary resources will be available to pursue strategies and achieve objectives. They also nominate suitable candidates for election to the board and establish and carry out an effective system of board governance. To truly understand a healthcare organization, it is necessary to get to the core of the organization, which is management. Three ways to look at what managers do are to take into account what function managers perform, what responsibilities managers are accountable for, and what choices managers make and how they spend their time and effort and with whom. Well-established management roles are key when establishing a healthcare organization. Managers are responsible for the determination of the goals and objectives. This falls under the planning management has to do. They are responsible for structuring dollars, services, and equipment to accomplish objectives, which the organizing aspect of management. They motivate their workers to meet objectives, which is the directing aspect of management. They assemble and synchronize different types of activities and participants, which is the coordinating function of management. And managers compare actual results with the objectives, which is the controlling aspect of management. Like everything else in life, there are challenges that both the board and managers have to handle in order for the healthcare organization to thrive. Here we're going to look at some of the challenges for both board members and management. Board members have to constantly deal with making sure the organization has revenue that cover operating costs. They have to make sure the organization is delivering high quality services and making sure that health outcomes among patients served are excellent. Managers, on the other hand, have a different set of challenges to deal with. Managers deal with internal challenges of measuring processes and outcomes to allow for continual improvements in operations. They must create an environment that supports excellent clinical care. Providing a supportive environment for clinicians involves establishing what the dimensions of that environment consist of. The manager needs to observe the working conditions at local and peer environments, communicate with clinicians about their views and feelings, and learn from the field and literature what works and what doesn't, and why certain things work or why they may not work. Another key challenge managers face is motivating and supporting staff reporting to the manager. Board members, investors, and stakeholders agree that this is the manager's job to measure operational processes, supply need, support to the clinicians, and communicate with staff who are direct reports. Now let's discuss ways to improve performance within the field of management. Performance can be improved by HCOs investing in management training and research. Some healthcare organizations provide 1 to 2 weeks of paid time for professional development and training. Other HCOs organize short courses and lectures on site and also pay for part-time or full-time education. Continued education and professional development deserve more investments and further improvements in terms of quality, content, and accessibility. Okay, next we are going to discuss healthcare management as a career for those of us who may want to take up healthcare management as a career. This first video that I've attached is a 6-minute YouTube video on what is healthcare management. It gives a quick view of what healthcare management entails. And when deciding to take on healthcare management as a career, it's important to identify your path. Careers in healthcare management can start in a person's junior year in college, and an undergraduate can also pursue specialization in social sciences and quantitative methods. And this next video that I have attached is a YouTube video on the roles of healthcare managers. The video gives some insight into various healthcare manager positions. The video is about 3 minutes. I found it useful in identifying what different healthcare managers do and what positions they hold. Lastly, to wrap up Chapter 14, we are going to briefly discuss evidence-based management. Evidence-based management brings systematic data and information together to guide organizational improvements. Here I've attached another YouTube video which discusses what is the need for evidence-based management. It's about 5 minutes long, and I found it useful in understanding why we do need evidence-based management and what it entails and who would use it. It was very helpful.